what I want to talk about today is really kind of this integration of how do we, a lot of you work in communities, either with community organizations or public sector or private sector, nonprofit sector. I want to talk a little bit about how we pull those together, and specifically talking about why parks and recreation are a solution to preventive public health. Because I truly believe, after being in the field, I started as a recreation programmer a long time ago, and then worked for a variety of agencies, worked my way up and started consulting with Green Play, and started that firm in 1999. In 2008, I was part of a group that started GP Red, which is a nonprofit that works with health, recreation, and land management agencies. And then I also later in life got involved with teaching at a university level. And so the idea of pulling this all together, that as we are looking at not only our own individual selves and being resilient, but how do we recreate body, minds, and spirits for the people who live within our communities? And so a lot of my focus is shifted from an individual level to a community level. And the reason for that is that I truly believe in the value of parks and recreation. And part of that is because I know that across the country, we provide access to land and facilities for over 80% of Americans. Most people have active recreation opportunities within 2 miles of their house. And we really are looking at all populations. So the idea that a lot of times parks and recreation are kind of that frontline provider in the public sector for people who may be under-resourced or may not have the opportunity to pay for things. And so we can do so through affordable programming. And then this idea of access to spaces. So I'm going to talk a lot about that. And I'd like you today to just really think about what is your role within that community level realm. Everything that we do is really focused around equity. And I know we've talked about that today, but as I'm talking through these, I'm going to give you, this is kind of more of a practical presentation. I'm going to give you a lot of tools and methods and ways that we really figure out how we can provide equity within our communities. And we need to make sure that we are giving everyone the opportunity to be as healthy as possible. And we can do that by removing obstacles, by really making sure that they have access to everything that we do. And we want to base that on the human rights principles, and then think about this whole interaction between our own individual, personal, and professional resilience, and then the idea of how we can really facilitate community resilience. In 2009, I had a really great opportunity. I was hired to do a recreation and wellness plan for Antarctica, for the National Science Foundation. And so I got a chance to go down on ice, as they say, and really look at how that community of about 1,800 people is created. And the reason that I was hired by the National Science Foundation was they were realizing that that community, this is a temporary community, but it's created every year, but people were coming down and losing all of their general support systems and becoming stressed. And so what was happening was people were eating too much, drinking too much, and doing other, what we call non-sanctioned behaviors. And so what they wanted us to do was look at, okay, how can we help people be healthy and well in this community? And that really sparked even more so for me the interest of how in a community, when people are stressed, we are even more important. And I believe that's very much true right now through the pandemic. So we talked through that, what is our role in helping people? We know that people have their own individual constitution, and the backgrounds that people come from are very important. We also know that our medical folks are incredible. If we get sick, we want to be able to have great medical care. We know that nutrition is key in terms of an aspect of having healthy things that we can put into our body. But this whole piece of recreation, or as I like to say, recreation of body, mind, and spirit, is really part of what we can provide in the public parks and recreation realm. So whether it's cognitive or physical, and we talk about spiritual, obviously we're not offering a lot of faith-based items, but a lot of people get their spiritual wellness from being in nature. And so I think it's really, really important. The more stressed an individual is or a community is, that we are there and helping with this preventive health process. There's a whole lot of evidence in guiding theory. I got my PhD at North Carolina State University, and my dissertation actually was focused on looking at which are the modifiable health factors, or in the public health realm, a lot of you are from the public health realm, often called social determinants of health. And so these are the primary factors that we have found that parks and recreation agencies can best address. And so those are physical activity, nutrition, the psychological and physical benefits from access to spaces in nature, the social benefits and social engagement and parental engagement, along with this whole idea of equitable access to things through transportation, and then also the interactions with perceptions of safety. In addition, one that's really emerging and is very crucial this year, as I've mentioned, is this idea of how we can help people learn positive mechanisms for stress management and to reduce non-sanctioned or ineffective, non-healthful coping mechanisms such as smoking or too much alcohol or consuming drugs. I'm really looking at this, and when we talk across the country, we're looking at a systems approach. And so a community is a system. And there's a whole lot of research out there that shows that having parks and recreation public spaces available in a community is crucial for well-being and reduced stress, whether that's flora and fauna, like plants and animals. There's a whole lot of research that talks about the plants and animals and the open spaces really provide that strong mental, cognitive, and psychological rejuvenation. Also, having places to move your bodies and gather together in community spaces. And we're seeing a huge impact right now on social support because a lot of people, we can't gather due to the pandemic. But all of these things together create this systems approach. A lot of work right now is focused on this access to nature. And so with GP Red, we're focusing a lot on what is the connection between public land and having access to places where people can move. There's a lot of research that shows a lot of us get our rejuvenation or recreation of spirit through green spaces and plants and animals. Some people get it from water. I'm actually a water person. So personally, I would love to be near a lake or an ocean or a river any given time of day. You know, I say any day I get to float is a good day. And then some people really love the desert environment. And the research is showing that depending on your ancestry, where your people were from, is really about your own personal preference for certain types of environment. So we can integrate that along with the medical care and the insurance providers who are really starting to recognize how important this access to these spaces are. There's a strong role that we can play in terms of getting people into nature, whether that's nature and forest therapy, forest bathing, or some of you are familiar with the term Shinrin Yoku, getting people out into nature through guiding. But also in conservation, because when people are used to being in nature, they are more likely to conserve the land and take care of the land. And then this integration of people who actually provide the business sector, outdoor retailers and suppliers, and how that ties into tourism. So all of this is a very key piece of preventive health. GP Red has just picked up the organizational oversight for the SHIFT conference, which will happen in October. And so if you're interested in this arena, I would encourage you can get in touch with me or look on the websites for either SHIFT or GP Red and find out more about ways to get involved in this piece of the story. This next graphic that I'm showing is around kind of the system piece of looking at the factors that I've just mentioned. All those things on the left are basically in kind of shades of green. But then on the right-hand side is all the people, and a lot of you are part of these actors, whether you work for Parks and Recreation, or you're in a public health realm, or you're another nonprofit partner or provider. You may be in academia or schools, and how we work together there, along with the research community. But the whole point here is that we have to be able to work together and have actions on all levels in order to modify preventive health through Parks and Recreation systems thinking. So taking that all into account, we have led a lot of different plans where we have started to integrate looking at preventive health within Parks and Recreation master plans and system plans. And so these are just some logos. I'm not going to run through these, but these are communities where we have honed the various tools that I'm going to quickly show you across the country. And the cool part is the insurance companies really are starting to get this, and they are starting to fund these plans in certain situations. So as you're thinking about, if you think about how you might get this done, a lot of times those insurance companies can be key partners. This is an overview for kind of that systems analysis. And we want to start with why we're doing it, which we call warrant for action. There's always this crucial piece of making sure we have the right people at the table and that we are looking at the system from the stakeholders, the people who live there, and how those all intersect so that all voices are heard. We have to make sure that we'll do a really detailed kind of, we call it an inventory, kind of a collection of assets and affordances. And I know Dave Peterson and Kaylin Valier are here. That's their specialty, making sure that we can identify everything that's owned and managed by the public agency, but also often the partners or the homeowners associations or other people within the community so that we can look at what that access truly is. In addition, we have to look at policies and laws and then always the money. You know, where is the money coming from? Where are the resources and the dollars coming from? But in addition, how can we tell the story around this idea of return on investment? So it's not just about subsidizing things. It's about really, the research shows that if you put certain amounts of dollars into preventive health, the return on investment is much higher than the actual investment itself. So we're always looking for how we can improve. But one of the first things we want to do is make sure that within any given community, we're looking at the demographics and making sure that we're looking at things like sub-area analysis. This is from a community where we had 4 sub-areas. And they had very different demographics within the different sub-areas. And the point here was to look at, okay, how are the things that we're providing within Parks and Recreation and Preventive Public Health, how are they reaching the various sub-areas or the people who actually live in the community? This whole idea of engagement has just grown exponentially. During the pandemic, I mean, we've been working virtually since 2010. So doing virtual meetings was not new for us. We can use simple engagement platforms. We call ours Mobile Optimized Engagement, so that people can participate from their couch or wherever they are, whether they're walking. So this whole idea of virtual participation has really increased the number of people who are participating in our information gathering, and also in helping us educate through and get information back to decision makers within the community. So I'm not going to run through all these different types of tools, but we have a whole variety of them that we can kind of select and create kind of what we call a mixed methods approach for any given community, so that we can figure out exactly how to get the best information that we need. One of them is surveys, and this is just an example. I'm going to include some examples from some of our projects in Colorado. This whole idea of looking at those preventive health factors that I talked about and actually asking people within the community within a statistically valid survey. So this is just some results from Fruta, where the number one, they're different in every community, but in Fruta, the number one priority for preventive health factors is physical activity, and then second is increasing access to natural environments. In some communities, it's different, and we'll talk a little bit more about that in a second. But we can really go in and ask and get a really good idea. So we can also do that through what we call intercept surveying, finding people where they are, especially when we're not in the middle of a pandemic. And there's all sorts of different types of surveying techniques. But the idea here is to get a feel for which of these factors are really playing a key role within that community. We also have special methods now to talk with the kids, the youth, and we primarily focus on middle school students because that's when the research shows that's when people are starting to make their own individual decisions. And so if we can affect change at that middle school age group, then hopefully these are lifestyle choices that people will carry forth as they go forward. So we have a special survey that we call the Youth Activities and Nutrition Survey that we usually do with schools. And we really try and get findings for all of these things, activities, nutrition, all of the different factors that I have mentioned. And we can tell what they're actually doing, and we can figure out ways that we can affect the youth within that community going forward. I talked a little bit about Dave and Kaylin, their inventory. This is just a slide that talks about the key piece here is that we're looking at everything within a community on a component basis, meaning that playgrounds are a component, ball fields, access to water, trails, all of those different things are components. And so when we're not only looking at what's there, but also how is it functioning? How is the quality? And then in addition, we can look at program locations. We can look at this whole idea of walkability and access to things. But the latest things that are happening in the last few years is this ability for us to assign energy expenditures to those components. So we can figure out if physical activity is a priority like in Fruta, we can figure out where we want to put different components that are especially valuable for increasing physical activity. This is just a perspective looking at, we call it GRASP Active is the system that we use. And this is just an example from both Golden, Colorado and Fruta, Colorado, where we really looked at all those components, where people were actually using them and where the gaps are. So this kind of heat mapping or gaps analysis is not new. A lot of people can do that. But there's a whole lot of data behind this that really incorporates the participation rates and the active energy expenditures that get to kind of the community-specific picture of what's really happening in these communities. All of this can lead to better active transportation and systems planning. So What we want to do is connect everybody in the community to the places and the items that are going to help them rejuvenate, that help them recreate their body, minds, and spirits and have that preventive health aspect.